of Centralized Nurse Triage.
And I'm Catherine Oslam, the Medical Assistant Academy Coordinator. We wanted to give you some updates about the RN Triage class. So far, we have had about 120 RNs go through out of 274. The pre-test average is 63% and the post-test is 82%, so a nice improvement of those tests. The class is working. Weekly classes will continue through December 31st, and in 2025 we will offer classes quarterly for new RNs and new hires and RN transfers.
Well, that's pretty impressive.
It definitely is. So thank you to all who volunteered at the 2024 Skills Fair. It was a great success.
Yeah, just to run some numbers by you, 394 out of 527 of the required clinical staff hired before July 1st attended the fair. 106 other clinical staff were exempted from attending because their department had 2 or less skills to be reviewed. So the exempted department sent 1 person to the fair to train the exempt staff.
And anyone who did not attend should follow up with their site supervisor for the next steps. A few knowledge gaps were noted in urinalysis and EKG placement, and we will address those gaps in future episodes.
Okay, great. So the EEMG Nursing Council is working on refreshing some of the department councils. Currently, this council is focused on rebuilding the primary care councils for Edward and Elmhurst territories. After these 2 councils are revived, then we'll move on to reviving specialty department councils. If you are in primary care and interested in being involved in your department council, please email us at eemgnursingcouncil@eehealth.org.
And last month we had a refresher demo on how to locate the deltoid muscle. In September, we will focus on the ventrogluteal muscle.
Well, that's good, because that seems to cause a lot of anxiety for staff, that site.
It sure does.
Producers, could you play that video, please?
Hi, Marie.
Yep.
My name is Catherine Oslam. I am your nurse for today, and I have to give you an injection. Is that okay?
All right.
All right. So what I'm going to do is give you an injection on your bottom. So when I'm done here, just go ahead and lay on your side, and I'll need to expose that area. Would you mind confirming your name and date of birth before we begin?
Marie Adams, December 7, 2004.
Perfect. Thank you. All right, Marie, I'm all set. I'm going to go ahead and check for my landmarks.
Wait. That is not the way we do things with the injections now.
Oh, who cares? She's used to doing it this way.
But it's best practice that we do the ventrogluteal now. It's safest for the patient.
So what? She's used to doing the dorsal gluteal.
But I know it's a scary transition, but ventrogluteal is the best thing for the patient right now.
All right, Marie, I'm going to go ahead and put it into the side. It's called the ventrogluteal muscle, so I'm going to go ahead and put it there. It's just best practice. So I'm going to find your landmarks. The first landmark is going to be the greater trochanter. I'm going to put my palm on that area, and my middle finger is going to point to the iliac crust. My pointer finger is going to point to the iliac spine, and my thumb is going to point to the pubic symphysis. So the V that is made between the middle finger and the pointer finger, right in that center is where I'm going to give that injection. Is that okay?
Okay.
All right.
Great job with finding the landmarks. This is the best place for the patient.
Oh, geez, I never get my way.
All right, little pinch.
Wonderful job. You did a great job with that injection into the ventrogluteal.
Okay, well, what a great refresher.
It sure was. Just a reminder, there are several appreciation weeks coming up that are listed on the screen. Other reminders include flu vaccine requirement through November.
Okay, well, that's it for today's Council Connect. I am Lisa Narducci,
And I'm Catherine Oslam.
where we connect with you.